So, Dr. Ashton, the other question is whether or not the medical system is prepared for all this.
Right.
What is your sense? I mean, are they prepared for the onslaught that appears to be coming?
We don't know what the U.S. crisis surge capacity is in this country, John. It has never been tested to the magnitude of the range of worst-case scenarios that you discuss with Dr. Anthony Fauci. So I can tell you that as of Friday, with the authorization that the president gave for hospitals to enact their emergency preparedness plan, right now, every hospital, particularly in those cities that are experiencing high numbers of coronavirus cases, they are activating their disaster plans, which, to be clear, has to do with supplies, space, systems, and staff. And when you talk about staff, just one part of that, you're talking about looking at things like bringing in retired nurses, respiratory therapists, physicians, actually recruiting some volunteers from the community. When you talk about space, you're going to see looking at hotels or schools that are closed, or convention centers, community centers, in case they need to house large numbers of patients. We have never implemented a response along that level. And so right now, that is the concern. And that is precisely why when you hear aggressive social distancing measures and steps like Tom was referring to, that is so critical. If our hospitals get tested to that extent, we have to remember, people are still having heart attacks. People are still having strokes. People are still having accidents. Those people still need care. And when you start to see an implementation of what we call a reverse triage, where stable patients are discharged or moved to other facilities, that's a serious situation that we have no idea how it's going to unfold.